especially that what are the post-COVID cardiac complications. And the second thing is to be what are the signs of warning signs of the post-COVID cardiac complications. Third thing is how to treat that post-COVID cardiac complications. The fourth one is how to prevention. So prevention always better than cure. So the first of all, I would go for that. What is COVID? You all are familiar with COVID, like the SARS-CoV-2 infection. The recently or pandemic, it is 2020 March. It was WHO has highlighted that it is a pandemic and declared that as a pandemic. So people are thinking that the COVID is mainly affects that only the lung. Only people think like that it's a lung disorder. No, that is not exactly right. The COVID is a systemic disorder. It is involved in the entire body. It causes that systemic inflammation. So the wherever that angiotensin converting enzyme is there, the receptors available in all the body. So majority of the AC inhibitor, AC angiotensin converting enzymes receptors available in the lung only. This is the main entry point for that COVID SARS-2 infection, for SARS-2 virus. So that main target is angiotensin converting enzyme receptors. So wherever the receptors available in the body, it targets. So the receptors available not only in the lung, major lung is involved, but it involves in the heart, it involves in the vasculature, it involves in the kidneys, it involves in that liver, it involves in the brain. So it's involved into all over the body, wherever the receptors are available, so it involves. So it causes the systemic inflammation. So not only lung, all over the body is involved in COVID. So the COVID is again three categories that divide into mild, moderate, and severe category based on that scoring they have given. CORAD's score has given 1 to 5 score. And at the same time, CTSS cardiothoracic systemic score is one more. CTSS score is available 0 to 12, 12 to 18, 18 to 25. They're given mild to 0 to 10, 10 to 18, and 18 to 25. They're given mild, moderate, and severe category. So that it involves all over the body, COVID, not only in the lung. So if you people like everyone is aware of that, that if it is involved in the lung, so severe cases definitely more concentric care is there available. More concentric patient is admitted in ICU, so the number of consultants are available, and everyone is treated properly. So the complications are familiar with that all. But mild to moderate cases, people are neglecting. Some of the people are treating at home and everything. Those people actually, if it is not controlled, that infection part, if it's not treated properly, precautions not taken properly, those patients, those of mild to moderate category, now they're presented with different kind of symptoms, especially the cardiac problems I'm saying. So generally, if you mild, moderate, or severe, any category, the cardiac complications in COVID for acute disease I'm talking, generally they will have myocarditis. The myocarditis means like inflammation of the muscle, cardiac muscle. I told you already that AC inhibitors where it is available in the body. So COVID will target the receptors and enter into the muscle. It disturbs that entire the cell biology. It releases the interleukins. That interleukins is again it disturbs that coagulation cascade and it activates the coagulation cascade. So the followed by platelet consumption, then followed by microthrombi formation, and then followed by disturbance of the cell. There is exchange of the oxygen that disturb the cell molecular biology. So there is a disturbance of the oxygen exchange. So the lung is developed of alveolar edema and everything that is mainly in lung. But when it comes to cardiac side, it mainly targets that muscle. So it causes that myocarditis. I told you already that is inflammation part. It involves all over the body. So that if it is muscle is involved, so that myocarditis is that most common complication I have seen so far in COVID cases. Whenever they get the cardiac referrals from that COVID patients, I saw that myocarditis are very common. The myocarditis is called as inflammation of the cardiac muscle. This myocarditis leads to that cardiac decompensation. That means like cardiac failure. Then some of the cases they develop that arrhythmias. So dysarrhythmias, that means like conduction system disturbances. They develop arrhythmias and everything. So the myocarditis, then followed by some decompensation of the heart, then they develop some these arrhythmias and everything. That is most common complications I've seen in COVID. Second most common complication is, I told you already, they disturb that coagulation cascade, like activation of the platelets, then followed by endothelial. Generally, it protects that this coagulation cascade, so that the disturbance of the endothelium of the vessel endothelium is there. It disturbs the endothelium. So because of these interleukins that released from the cell, it disturbs the endothelial part. So the coagulation cascade is to be like activated, then followed by platelet consumption, microthrombi formation. There is a, so these kind of things develop the patients. Generally, we have seen that they develop pulmonary embolism, and second most common is to be like of thrombus is acute myocardial infarction, and the third most common it develops that all over the body anywhere in that thrombus formation, not only in the uh, heart vessels, it develops into the intestine, it may develop into the lower limbs, it may develop into the lungs, that is called pulmonary embolism, it may develop into the brain, it may call as CVS, cerebrovascular accidents. So the most common complication first is the myocarditis. Second most common complication, thrombus complications like acute myocardial infarction, pulmonary embolisms, venous thromboembolism. These are the two major complications I have seen in the COVID cases. Third, so thrombocytopenia, the platelets is decreased because of the consumption of all those things. The patient may develop the bleeding complications. So it is both, it's a double-edged sword. So it may develop the thrombus formation at the time, the platelet is to be consumption, then followed by bleeding. So you have to balance the both things, both thrombus and the bleeding complications. So these are the major in acute complications I have seen so far in COVID cases. Especially acute complications I've seen so far in the COVID cases. Especially in severe cases, I've seen whenever I go like ICU setups, if the COVID case is admitted, these are the two most common complications I've seen. One is thrombus complications, first is myocarditis, then followed by cardiac failure. Already the lung is compromised, again the heart is compromised, there is no pumping forward, so there is a backward flow. Again, already in alveolar edema, there's so much of disturbance for that ion oxygen exchange. Then again, that the fluid is accumulated in the lungs. It's called pulmonary edema. The pulmonary edema and ARDS both it aggravates that the it has come so much of disturbance for that the oxygen exchange. That's why the patients, majority of the patients, they craving for the oxygen because of this. Because of two factors are involved. One is the lung is involved. The second thing is to be like of the myocarditis because the pump is not properly functioning. So that followed by the backward flow leads to again that the lung is volume overloaded. That leads to so much of disturbance for the oxygen. These are the acute complications I've seen so far. That okay, then we have treated that like for that intubator and for the ventilator high PEEP, the maintaining that, and with good oxygen support, we can overcome all those problems. At the same time, if it is thrombus formation, anything is there, then we can prevent with that anticoagulation. We can give heparin and low molecular heparins. If low platelets, anything fondaparinux can use. So these kind of things we can prevent for the acute setup. Suppose when the patient is to be like, how to monitor that if he is a patient is with thrombus is there or not in acute setups. We can see that acute phase reactions like the D dimers, the fibrinogen levels, interest IL-6 levels, and CRP levels. We are monitoring this all, especially for myocarditis, the troponin levels they see. So the people, especially in my cardiac setup, initially for the acute cases, we also confuse it because if the troponin is elevated, the troponin is elevated like 10 times or 20 times. If it is elevated, it both elevated in myocarditis, it is elevated, and at the same time, acute myocardial infarction also elevated. Whenever the muscle dies, also it releases the troponin. If it is to like of myocardium, if it is associated with pericardial involvement, all those things leads to troponin. So initially, also we also confuse some of the cardiacs in Italy and everything because of the mimic that it looks like mimic like acute myocardial. So they have taken cases for the revascularization and they open and they do angiogram and then immediately it was come as a normal angiogram. But it's like already the cardiologist, even though they're taking, even though they the protective measures they have taken so much, but even though they face the COVID infections, and one or two cardiologists also died because of this troponin elevation, the purely consuming on troponin. So that myocarditis and acute myocardial, there is some slight differentiation is there for ECG changes and troponin elevations, and the territories involvement. We have to see all those things. So we can now the all the cardiologists are aware, they are taken that aware the things which this because of this happened in Italy, then immediately all Indian cardiologists also they have taken proper measures before taking the case to for revascularization. So this is the mainly the thrombus formation, that myocarditis, that acute phase reactions. We have to monitor that continuously, the D dimer and the IL-6 and CRP levels and everything. We have to monitor. According to that, we have to give that anticoagulations. We have to prevent this. So this is the acute setup. I'm just briefing that COVID. What happened in the cardiac complications in COVID? Let us come to the post-cardiac complications. Okay, the patients are recovered and then they go to home, and this severe cases we have been, even mild moderate cases, they need them and they're monitoring, they are given some anticoagulation, so they go home. Suppose if some of the patients, moderate cases, they were treated at home, some places already they were already the patients who have risk factors like diabetes and hypertension. If it is mild, moderate COVID cases, some of the people they may not aware of coagulation thing, that the thrombus formation. So these kind of patients now the present with those who are treated at home, these kind of cases generally now I'm seeing that various presentation in the post-COVID. What are the presentations most commonly now the COVID cases, post-COVID cases for cardiac complications? They are present with the different kind of symptoms nowadays. Some people they come with palpitations. Some people they come with some chest pain, some heaviness in the chest. Some people they come with fainting. Some people they come with dizziness. Some people they come with uh, GERD, esophageal reflux. Some epigastric pain and everything. So these are the most common. Some people present with palpitations. I have seen so many cases for the palpitations. They have some tachy, the heartbeat is rising inappropriately low. This coming going to 100, 120, 130, 140. These are the most common symptoms now post-COVID complications. Even if you take mild, moderate, and severe cases. Mostly moderate and severe cases, these are the commonest presentation I have seen so far. Almost like 100 to 100 cases I have seen that post-COVID cases in OP. The majority of the people are presenting with palpitations, some breathing difficulty, some chest pain, some fainting, some dizziness. So this kind of now I'm seeing that COVID cases. So if the patient is the moderate and severe category, even some mild category also, if the patient is having of chest discomfort, anything, if the patient is having of any epigastric pain, if the patient is having any palpitations, like it should not neglect it. Go and meet to consult the cardiologist. He will guide you what are the investigations to be done. For simple ECG, one troponin line levels, and the second thing is 2D echo and then TMT. These are the four we can evaluate the cardiac cases. And the blood investigations to be done generally, the troponin levels and CRP, routine CRP levels, and the D dimer levels. These things we should monitor that, especially that moderate to severe COVID categories patients. So these are the general common presentation, the palpitations, dyspnea, these kind of. Generally, what are the most common post-COVID complications? The most common post-COVID complications is like a thrombus formation, like because I told you already, the patient is to be like of inflammation. Already endothelium needs to be like of disrupted, even though if it is to treat in acute condition. But in chronic patients, if you see that, they have the thrombogenic tendency. There is a thrombus formation chances very high in moderate to severe category patients. So those patients, maybe you were not treated properly in that. Maybe they were not sending the patients to without anticoagulation at home, inappropriately they are like they're taking medication without consulting a doctor at home, like anything. These kind of patients, maybe like the medication, maybe they're missing that, they're not using properly the medication, even though the doctor is suggested. Those kind of patients now, the most commonly they presented with thrombus formation. It presented with bilateral lower limb, both lower limbs, like venous thromboembolism, like DVT, and some patients present with tachycardia, dyspnea, and everything. Then I have evaluated recently 2 3 cases. They present with so much of tachycardia, and then they have symptoms of short breathing difficulty. Then immediately I have sent for that D-dimer levels and ECG and echo. I have seen that there is slight dilatation, right heart domination. So then we evaluated D-dimer is elevated, and we have sent for that CT scan, CECT, contrast enhancer CT. Then they showed like there is a big thrombus in that pulmonary artery vessel. So that then we have seen that the bilateral lower limb Doppler we have done, though they have developed that the thrombus in the lower limbs. So that even though the patient is treated, some inflammation in the body in COVID patients is going on still. So these type of patients, those who have inflammation, still CRP levels are higher side, D-dimer's bit higher side. These type of patients, post-COVID patients, they have to continue that anticoagulation at least 2 to 3 months. At least 2 to 3 months, they have to at least 6 to 8 weeks. They have to continue the anticoagulation. Then once that inflammation process, CRP levels has come down, and then if it is D-dimer levels have become normal, then only they should discontinue that anticoagulation. That is very, very important, especially for the post-COVID patients. So these are the most common complication I have seen that. Second most common complication I have seen that so far, the patient is coming with chest pain. Chest pain, like even though I have bent, that chest pain is relieved. So the slight of involvement of that of the pericardial layers, the serous and layers are there. The 2 layers of the pericardium is involved. So these kind of, if it is anything, some inflammation, it takes to resolve. All over the body inflammation, it takes 6 to 8 weeks for that to resolve completely the inflammatory process. So that if it is to be like of any pericardium involvement, anything is happening. So slight, if it is troponin level still a bit elevated, those kind of patients, they presented with pain. Even though if they do coughing, certain positions, if you take it as, you can see that they can have pain and everything. These type of patients, you can meet the cardiologist. They'll they'll evaluate completely that. Don't panic that if it is a chest pain is because of cardiac problem. But even if it is pericardium involvement, those kind of anything is involved. Uh, there is a bit of pain is involved whenever you take the deep breath and everything. Definitely, they are associated with some pain. So we can relieve in certain positions. So these type of patients, these kind of pain, need not to worry. You meet the consultant, you meet that nearby any cardiologist. They'll guide you. They'll check your ECG levels. They'll check your echo levels. They'll check you that your troponin levels and everything. And they tell you that this is not because of cardiac. This is mainly pericardium involvement. The layers of the surrounding the pericardium is involved because it takes to resolve that your pain and everything. What about third thing? Some of the people having of tachycardia, so much of heart rate. So much of heart rate. There is a fluctuation in the heart rate. Sometimes it's to like 80, sometimes 120, 130, 140 also. This is because in COVID, some conduction system is involved in our body, like SC node, AV node, and bundle of is. There is a proper conduction system is there for our body, electrical wires. So if it is to be like of any conduction system, once in the recovery phase of that recovery phase, like resolution of the inflammation and everything. So initially, the patient is to be in COVID cases. I've seen so many cases in the COVID, they develop the bradycardia, like heart rate is comes so even below 60 is there. I've seen so many cases of COVID because of some conduction system involvement in there, and that. That's why the patient has developed that bradycardia and the heart rate. So once the system is to be resolving, then there is a chance of development of the tachycardia. That is because of involvement of SC node, AV node, conduction system. At the same time, anxiety. Suppose patient is having some chest pain is there. People think like it may be a cardiac problem or anything. Like that, some anxiety, some lung reserve. Like initially the COVID is involved, almost like 50% of the lungs are gone, and 50% of some fibrosis has developed in that for 6 to 8 weeks of this period. The lung volume is compromised. For the lung volume, if it is 100% lung volume, then things are different. Heart is pumping 80 heart rate. We can with 80 beats is okay. But if it is lung is compromised, like for suppose 70% of your lung is working only, then heart has to go pump more and more. So definitely has to be like of tachycardia is more and more. So these things, we even if it has so much of heart rate, if it is, we can control the heart rate. Once you see that your lung volume is how much is there, then based on that, we have to control our heart rate and everything. Third most common complication is myocarditis. I told you in acute condition, myocarditis is more common. What are the myocarditis? Mainly is like of cardiac failure, decomposition of the heart, then followed by what do you call arrhythmias chances on that. That's why any athlete, the post-COVID athlete, anything for past 6 to 8 weeks, not supposed to do any athletic activity. They has to wait for that. Otherwise, if it is to be athlete, myocarditis is there in acute severe COVID in myocarditis. If you do aggressively athletic work and anything, if you do running, if you do any shuttle, anything aerobic exercise, aggressively, if you do, these patients may chance prone for that arrhythmias and everything. That's why I told some of the athletes also, you wait for the 6 to 8 weeks of the COVID. Once that inflammation is completely resolved, then you should resume your work and everything. I told them. So here also, the myocarditis, then the cardiac failure, cardiac decompensation, these kind of patients, they has to closely monitor. They has to do 2D echo continuously every 3 months and everything. And you see that you should start that AC inhibitors and then beta blockers and everything, and some antiplatelets, blood thinners has to use, and anticoagulation. According to cardiologist guidance, you follow that all the medication. Once the myocarditis, once the inflammation resolves, if you continue to use this medication, your heart function will improve slowly. Need not worry. So these are the three most common complications is to myocarditis, which heart failure. That is one. Second thing is to be like thromboembolism complications. So these are the major complications. These you can see that post-COVID complications. Second thing is, what are the signs I told you already? These are the signs. They're presented with tachycardia. They're presented with chest pain. They're presented with palpitations. These are the signs and warning signs for the post-COVID cardiac complications. Third thing is how to prevent these cardiac complications. You can prevent. Prevention always better than cure. Once you develop that acute myocardial infarction, that COVID cases, then again you have to take the vessel and everything. So we can prevent that all venous thromboembol, bilateral, the lower limb thrombus formation that leads to pulmonary embolism. This is the one most complication. Second most complication is like a thrombus wherever it forms. It may form into the brain, it may form into the heart. So if it is a thrombus is there in that heart vessels, because of already, especially for the diabetic and hypertension people, the plaque is to be like a very thin out plaque is there, that easily prone for that rupture and everything. Because of that, already as a patient is to be like a thrombosing tendency, high inflammation, already interleukins are there. So it can easily, the plaque is, if it is unstable plaque is there, it can go easily and then followed by rupture, then followed by platelet segregation, then followed by thrombus formation, then followed by acute myocardial infarction. These common, one of the most common complications post-COVID. So the thrombus, especially, it may come into heart, it may call acute myocardial infarction, it may have brain, it may call cerebrovascular action, it may go into lower limbs, it's called DVT, it may into lung, it's called pulmonary embolism. So the thrombus, mainly the thrombus complications, major complications, thrombus. So that we can prevent all these complications. How to prevent? So the severe cases, definitely everyone is there available while discharging the pulmonologist, surgeon, physicians, and along with the cardiologist. Definitely, they advise that 4 to 6 weeks of anticoagulation is mandatory for all the severe cases. The dose is to be like of according to your body weight. The newer anticoagulations are available like rivaroxaban, apixaban, and dabigatran is available. They adjusted the dose according to your body weight. Like dabigatran, if it is to be like 110 mg, 150 mg morning night, and the rivaroxaban 15 to 20 mg once in a while, once in afternoon, 4 p.m. Apixaban is also 10 to 15 mg. So this is the guidelines has given clearly that the severe cases has to start continuously for at least 6 to 8 weeks of anticoagulation is mandatory. So if you continuously on anticoagulation, you continuously monitor the D-dimer levels, you continuously monitor the CRP, inflammatory markers clearly, there is a less chance of thrombus formation in your body. There is less chance of less chance of myocardial infarction or CBA, anything in the body. There's less chance of myocarditis, less chance of that followed by cardiac function to recover normal, more chance of cardiac function to recover normal. So anticoagulation is mandatory. Along with that, blood thinners. If it is to be like a patient is diabetic and hypertension, antiplatelets like aspirin and clopidogrel. This one single antiplatelet, along with that of anticoagulation like rivaroxaban, apixaban, and acetone and vitamin K antagonists. These kind of this combination of the drugs, we can prevent that 98%, 99% of the complications, especially the thrombus complications. These and second thing is to be like adding of vitamin tablets like zinc, the vitamin B12, and all vitamin B complex tablets, anything. It will add and it decrease the thrombus formation chances. And you maintain that hemoglobin levels normally. Like hemoglobin, you should maintain like if it is to decrease the iron, if it is decrease the folic acid. If you take off the iron and folic acid also, then it is the less chance of thrombus formation. Then third thing is to be like if it is the lung reserve is less. So you have to do the lung exercise and everything while discharging we should advise the patients to all the lung enhance that your lung the pulmonary reserve mechanisms to enhance methods are there. So those kind of things according to pulmonologist, if you take all those things, you can improve that. Third thing is physical activity. Not too much of physical activity first 6 to 8 hours, first 4 to 6 weeks is not advisable. So physical activity, continuously bedridden patients, suppose if it is to be continuously on bed, a continuously sitting position, continuously standing position, continuously you have to change your position frequently. That may help into the less blood stagnation is there is a less chance of thrombus formation. So these are the main parameters. Like you should monitor that closely, that blood parameters, and you should change their physical activity measures, and you should eat the diet properly, like more of vegetables and fruits in your diet, and control the diabetes and control the blood pressures. So then use that anticoagulation 4 to 6 weeks, 6 to 8 weeks of anticoagulation, along with that antiplatelets. These methods, if you follow all those things, especially in COVID patients, we can prevent almost like 99% of the complications in the cardiac complications in COVID patients. Thank you very much, guys. Sharing of my knowledge on post-COVID cardiac complications, how to prevent. Suppose if the patient is developed that cardiac complications post-COVID, if it is neglected, if it is already developed that thrombus formation all over your body, like I have seen that many of cases I have seen that they presented with pulmonary embolism, they presented with the DVT, they presented with acute myocardial infarction, they present with heart failure. So I told you already the treatment patterns and everything, already developed symptoms, we can prevent with that. Suppose if it is acute myocardial infarction, definitely we have to go for angiogram, we have to see the vessels, we have to open the vessels, revasculation to be done. And at the same time, even if the cardiac maybe he was not not following the properly medication, they develop the cardiac complications. You have to meet that respected consultant doctors and everything. And according to that, you follow that. Now also after if you develop already complications, you should start that anticoagulation medication continuously. Take that cardiologist opinion. You follow the cardiac advice and properly. You control that diabetes, hypertension. You start that medication. Thank you very much, guys, for sharing of my knowledge in post-COVID cardiac complications. What are the complications are there? What are that? How to prevent the post-cardiac complications? If the patient develop the complications, how to handle that situation and everything. So this is briefly. Thank you very much, guys.